Coming up, we'll be on location at Greenbelt Oral and Facial Surgery in Greenbelt, Maryland, discussing the latest advances in oral surgery and how they can restore your smile and improve your dental health with one of this region's top oral surgeons, Dr. Elyassi. Dr. Elyassi is dual board certified by both the American Board of Oral and Maxillofacial Surgeons and the National Board of Dental Anesthesiology. Dr. Elyassi also received his DDS degree from the University of Maryland Dental School and has completed his oral surgery residency with the Tripler Army Medical Center and is widely recognized as one of this region's top oral surgeons. Welcome, Dr. Elyassi. It's a pleasure having you on our program.
Thank you for having me.
It's, in fact, your first time on the Top Doctors interviews. We have a lot to talk about. We have some patients that are going to join us a bit later. But I wanted to begin, if I may, Doctor, by having you please tell us what some of the latest advances are in oral surgery.
Some of the latest advances are the cone beam CT technology that we have, the pre-planning, having surgical guides, having things that are minimize surgical time. Everything that's pre-planned with our 3D imaging software so that when the patient is in the chair and getting their surgery, it minimizes surgical time. The other advancement is, of course, regenerative medicine. We have stem cell regeneration available to us right now. However, it's still in the workings and the little kinks are being worked out. However, it's still a great addition to our surgical armamentarium.
In the area, I would think in the bone density, as far as the bone grafting, areas like that, to promote and stimulate growth and strength, which helps with implants, for example.
It would be wonderful to be like a shark or a rat where they can regenerate their own teeth. And hopefully humans can get to that point where they can regenerate their own teeth, because nothing is better than your own tooth. Right. But we have the dental implant, which is the next best thing to your own tooth.
Yes.
And the dental implant has to go into bone that is a good substructure, kind of like the posts for a house. They go into the foundation.
Yes.
And that foundation can be built with one of the things that we have is stem cell or bone morphogenic protein, which can help regenerate the bone, whether the defect is as a result of the missing teeth from a trauma, from an accident, from decay or bone loss or gum disease.
Yes.
We have that technology available to us.
That to the benefit of all the folks, right?
To the benefit of all the folks.
Yes, indeed. And now you mentioned dental implants and touched on it briefly. I wanted to ask you more about dental implants because they're helping so many people each and every day through oral surgeons like yourself that are installing them and placing them into people who have, I take it, missing teeth, broken teeth, crooked teeth, who need something like a dental implant or dental implants. Can you tell us about that and some more of the problems that they help with?
Absolutely. We have a lot of patients that come through that need all their teeth extracted or have several teeth that are missing. And these dental implants help to restore the arch form, the teeth, the ability for these patients to be able to function normally. Not just that, but cosmetically it changes a patient's perception.
Yeah.
As you will see in the later segments, you're going to talk to patients that had the dental implants, and it puts such a brighter you're going to see a bunch of patients that have these dental implants, and you're going to see that it really changes their affect, their mood, because cosmetically, a couple of things that we face on a daily basis is face-to-face conversations for cosmetics, and functionally, one of the best things is to be able to eat, and by having the ability to restore these teeth with dental implants, we're able to give these patients back their teeth.
Yes. Yes, indeed. No, it's a tremendous option. And I wanted to ask you, Dr. Elyassi, are there different types of dental implants? In other words, different implants for different folks?
There are a lot of dental implants. There's a lot of different surface technologies associated with the different dental implants. whether you come to me or a different oral surgeon, you want to make sure that you are educated by your surgeon,
Yeah.
so that they tell you exactly the implant type that you're getting. You're not getting some generic form.
Sure.
You're getting something that works and is made for you. And I have a bunch of different dental implant systems on purpose, so that depending on the patient, their needs, I'm able to use the different systems in order to give them their best treatment.
Now, I also understand there have been advances in technology of placing dental implants that have made the whole process more efficient, less timely.
So I can get a CT scan of a patient,
Okay.
send the files remotely, and after pre-planning the exact placement of where I want the implants, having a stent made and fabricated, so that when the patient's in the chair, we're minimizing the surgical time. And one thing that's very important is you want your surgeon to work efficiently, because surgery means trauma. And trauma, the more surgical time, you're looking at more postoperative edema, swelling,
That's right.
postoperative pain, longer recovery time. So by having that technology where we have everything pre-planned, we can have minimal surgical time where the patient is in the chair for a less amount of time, because everything is precise.
Yes.
Everything is pre-planned. And not only that, if your patient's being sedated or put to sleep, it decreases morbidity and mortality,
Yeah.
because it's less time of anesthesia. As you know, all drugs are toxic to the body.
Absolutely.
And this, being able to be more precise and to the point, you can get a better result and a quicker result.
Which is what all patients are ultimately looking for when it comes to a surgical procedure.
It's trying to strive for perfection.
Yes, absolutely, and that's what helps it get there in this area. I know you touched on the length of time for the dental implant surgery having been reduced through the advances in technology, but what is, for the folks out there watching, what is somebody typically looking at? And I'm sure it varies depending on if they're getting multiple implants and how much work is needed, so on and so forth, to each respective patient, but in general, what is somebody looking at as far as the time of having a implant procedure done?
Absolutely. Good question. It all depends on the patient. It all depends on the bone. I do like some things, old school techniques are good. So in some patients, some cases, I prefer to stage things and make it more predictable.
Okay.
In some other cases where we have the ability to do so without causing any patient harm,
Yeah.
be able to extract a tooth, do the bone graft, and place the implant simultaneously, and have the patient get a temporary crown made simultaneously,
Yes.
so that they're walking out of the door with a tooth.
Oh.
So they're not walking around, especially if it's in the front area.
Exactly, because then it's, like you said, very visible, and it's not what somebody wants.
Right.
Now, what are some of the benefits, Dr. Elyassi, of having dental implants over, say, for example, dentures or other dental options?
One of the best things that happen to our denture patients are dental implants. I can't count the number of patients I get that come in with their dentures and say, "Doc, I cannot wear my denture. It's just intolerable." And with a simple adding 2 implants to their arch, we can get their dentures to fit and snap into the implants. Or we can get, with an additional 4 to 6 implants, we can restore an entire arch where they don't have to remove a denture in and out, and they can get a fixed prosthesis.
Oh, very interesting. So folks out there watching, if you have dentures, you may want to upgrade to dental implants. It gives you a
Absolutely.
lot more natural feel. It's like you have your own teeth back again.
Absolutely.
What type of results are your patients seeing in the dental implant procedures that you offer?
With dental implants today, with the technology that's out there, with the predictability that we have, the surgical tools that we have, they are over 95% successful.
That's
Which
very
is
high.
amazing. That's not a coin toss. It's not a
Yes.
50-50 gamble.
Yes.
We're looking at over a 95% success rate, where the implants will come and they will stay the first time around. Now, occasionally you will have a diabetic, smoker, or a patient that doesn't accept the implant like a normal
Sure.
sort of average Joe.
Sure.
But through a couple modifications of technique, grafting, regrafting, we can get that implant to stay.
To take, basically,
We-
by customizing and doing additional work if need be.
By modifying our
Yes.
technique or our materials.
We're now going to meet some patients of Dr. Elyassi.
Wow. I had to have all of my teeth pulled. I had a very raggedy mouth. And I had to have my teeth pulled out for a heart transplant. I am now listed for a heart transplant. Your teeth is very important for your health. So they had to pull them all out. My insurance didn't cover much. So basically, I came here through donated dental, which is the best move I've ever made. My experience with Dr. Elyassi was awesome. I had a bad experience with another dental program, and I was terrified. I put off getting dental work for years. I came in here, they made me feel so comfortable. I'm a crybaby. I loved them. With my heart issues, they were concerned. They kept my blood pressure under control. They made sure this is my heart pump. They made sure my numbers were correct. They made sure my breathing was done. I was not able to be put to sleep, but the numbing, it was worth it. It was worth it. And the assistants, the ladies at the desk, the assistants that help in the office, back in the back, they made me feel really, really comfortable. I will come back. If you're afraid, like me, I would think I need to go to a children's dentist. The staff here will make you feel very, very comfortable. The pain, they made sure they talked me through it. If I said ouch, the first thing he said was, I don't want you to feel no pain. And he made sure that I did not feel any pain, because that was my worst fear. So, and I just got mine done yesterday, so that's why I'm talking kind of funny, but I love it. I love my smile. Thank you.
I had initially had a couple bridges, and my primary dentist referred me here. I lost teeth in the front. I've been wearing dentures for about 25 years, and I just needed to have my teeth redone. I had implants. I had 9 implants, 4 top and 5 at the bottom. It went extremely well. The Dr. Elyassi was absolutely fantastic. And actually, in the beginning, I was trying to put it off. I had gotten scared because I've had some really bad results over the years with dental work. And I think I called Lauren and told her that I wanted to postpone it. And she talked to the doctor, and he wanted to see me, so I came in and he put me at ease, said everything was going to be okay. And it was. It was. Absolutely. He was fantastic and patient. And I had a million questions. Yes, my experience with Dr. Elyassi was fantastic. He was very patient, very warm, very inviting. He ensured me that I would be okay. I came in for initial visit, a consultation, and then after I got cold feet, I was called back for reassurance. I came in on the morning, it was a Saturday morning, Saturday around lunch, I believe, and I'd had some medicine that he had given me to calm me down. And after the surgery, everything went well. Of course, I was in pain, but I healed very quickly. The staff was wonderful, wonderful. Lauren and the other young ladies have been fantastic. Very responsive, very assuring. I've had a great experience. Yes, if I had to do it over again, I would. Okay. If I had to do it over again, I would. The only thing that I didn't expect is that I would not have my teeth readily available. And because I didn't account for the swelling. But everything else was fantastic. And I love the end result, which I haven't got to yet, but I know I'm going to love it.
Interesting question. So my husband and I had problems with the same tooth, and I felt that his oral surgeon was too expensive. So I asked my dentist for another suggestion, and Dr. Elyassi was actually right down the hall. I came in, it was $300 cheaper, and the office was full of people. And we scheduled the surgery, I think, for within a week or two of that point. And it went really, really well. I had an implant put in, and it was really interesting. I could have it done with or without the gas. That would put me out of things. And I decided I would just go ahead without anything other than the numbing. At no time did I have pain. Not when Dr. Elyassi went in. During, afterwards, I did not have to take any kind of pain medication. It's been several months. Dr. Elyassi has checked me a couple of times since. No pain. It's been pretty amazing. It's been a pretty amazing experience, considering, dental work in my life. So I just love this doctor. I don't know how he has room for any patients, because he is such a great doctor at such reasonable prices. Plus, he is so patient. I can't say enough good. But the big thing, and I keep telling him this, he has such calm, positive energy, and that's really great, because a lot of people come in here with anxiety, and man, it really becomes not a horrible experience, not even a bad experience, and for some of us, a positive experience. Actually, I think the staff here is really terrific. It's really clear who does what. They're very organized. I haven't had any kind of issues. They've been really available when there's been questions. They answer them right away. They'll do research. The office manager, terrific. They just seem really, that's Lauren, really, really together group of people. Like, they've been working together a long time, and there's a really great sensibility. I actually think you come into this office and the whole office is calm. It's pretty cool. Unless you want to go somewhere else where, you want to hurt, this is a really good place, because Dr. Elyassi, and I have fibromyalgia, so I'm really sensitive to pain. And the fact that I didn't have any is such a testament to good dental work. I don't know what else I could say. We're
now back with Dr. Elyassi. The patients love the results. They love you and your staff. Some great work, Doctor.
Thank you. I appreciate it.
Now, Dr. Elyassi, I wanted to ask you, how long do dental implants typically last? And again, I put in the disclaimer, I'm sure it depends on each particular patient and how they are and maintain themselves, but in general, what is somebody looking at?
Well, as you know, nothing lasts forever, but just like a knee replacement or a hip replacement or filling or any sort of prosthetic device, a crown, the average lifespan is 10 to 15 years.
Oh, it's a good amount of time.
Yeah, you have the patient that has it for 30 years, you have the patient that has it for 5 years, but of course, with the technologies that we have, now we're able to catch on why these older implants failed.
Yes.
And now replace them with the newer implants that have different surface technology and that are able to last longer.
That's one of the main benefits, right? Through the advancements in technology.
Absolutely.
Now, we're literally out of time, but I wanted to ask you, before I let you go, Dr. Elyassi, you and your practice here in Greenbelt, Maryland, have certainly established a reputation for excellence. Not only are you widely recognized as one of this area's top oral surgeons, but your staff and yourself, all of you here at the practice, have a great reputation in patients' care as well. And I just wanted to ask you if you could please tell us what you feel helps separate you all apart from many of the others.
Well, good question. We strive for perfection. Just like anybody else or anything else in the world, we're not perfect. But we strive for that perfection because we want the best for our patients, not just have the safety in mind. And of course, we've taken the oath of do no harm, but and not just have great customer service, but the most important thing is perfection. In whether it's from the front desk of the patients being received with good customer service, all the way to reflecting to the back, where I make sure that everything's looked at from a pre-planned surgical point to all the way to the post-operative phase where our patients get the attention they need and they deserve, not treated like an assembly line, but having that quality of care versus the quantity of care.
You have a great reputation when it comes to all those areas that are so important to patients when they're looking to decide on who to go to as far as oral surgery and various treatments. You have the state-of-the-art technology, which you've touched on earlier as well, that's making the whole process less timely and a lot more efficient. And the results you mentioned earlier, about 95% or more in success rates as far as your dental implant patients. A lot to be proud of, Dr. Elyassi. You really do, you and your staff here.
Thank you, I appreciate it.
And on that note, I'd like to thank you for joining us, being a guest, educating us, and we'd love to have you back on in the future.
Thank you for having me.
Our pleasure.